All right, thanks everyone for joining our annual DAP webinar. I'm Israel Ortiz, the Manager for Quality and Population Health Improvement here at Contexture. We are diving into the Contexture programs within the DAP contract year end, or CYE 2026. For the next hour, please keep yourselves muted during the presentation. Don't worry, we'll have time at the end for you to unmute and ask any questions or share your thoughts. Feel free to drop your questions in the chat as we go along during the presentation. My awesome team here will be keeping an eye on those, and we'll answer some in the chat and others at the end. Just so you know, this webinar is being recorded and will be available to you shortly after. This also will be posted in our Contexture website, along with the slide deck used for this webinar. All right, so with that, we can move on. And I'm gonna welcome you to my office. Full disclosure, it never looks this clean, so I had to clean it for you all. My clock batteries are dead, so it's definitely not 1028, so I apologize for that. I knew I was forgetting something, but you know how it goes. All right, so let's talk a little bit about us. I would like to introduce the quality improvement team. This team is formed by Cassie Sergio, Kyle McDonald, Natasha McLean, and Larissa Kruger. The quality improvement management team is formed by our director, Megan Riley, and myself. All right, so our agenda for today, first, we'll talk briefly about Contexture, followed by the DAP program review and eligibility. Then we'll cover the SDH solution that is housed here at Contexture. We'll cover program by program and the requirements. We'll provide a quick tutorial video on how to complete your participant list. Subsequently, we'll go over the submission process for the statement of work, or SAW. We'll cover the roles and responsibilities for both sides, Contexture and participants. And lastly, we want to allocate some time to go over your questions, as I mentioned before. Please note that the team will be taking turns presenting during this webinar. Also, some of the following sections have been pre-recorded to ensure the quality and accuracy of the topic points presented during this webinar. So with that, I'm going to remove my camera just to make sure that you see everything that you need to see, and we'll come back at the end. So let's get started with this.
About Contexture, who we are, what we do, and our mission. Contexture is the leading health information exchange HIE for Arizona and Colorado. We are the largest health information organization in the Western region. Contexture is a nonprofit organization that provides strategic, technical, and administrative support to communities committed to advancing health through information sharing. Our mission is to advance individual and community health and wellness through the delivery of actionable information and analysis. HillCurrent was founded in 2007 and joined Colorado's HIE in 2021 to form Contexture. Our services allow providers to securely share clinical information among different systems. We partner with 1,100 plus participants and continue to grow. We have more than 300 data sources sharing medical records into our HIE. We securely store and share data on 12 plus million individuals. We are home of the SDH referral system, Community Cares. Now we'll take a quick review of the DAP CYE 2026 programs and provider type eligibility.
Thank you, Israel. Differential Adjusted Payment, or DAP, is a value-based payment strategy implemented by Access, which provides pay increases to eligible providers who successfully meet specific milestone requirements. The primary goals of DAP are to enhance patient experiences, improve health outcomes, and reduce overall care costs. Contexture has been a vital partner of Access for many years and manages the DAP programs listed here. Additional DAP programs can be found in the public notice and are overseen directly by Access. For inquiries about those programs, please contact Access directly. Additionally, please be aware that the Arizona Healthcare Directives Registry, or AZHDR, is no longer a DAP program for the contract year ending, or CYE 2026. The DAP schedule is aligned with the contract year, which runs from October 1st to September 30th. The preliminary public notice was released at the end of January and is open for comments through March 1st. The final public notice is set to be released on March 15th. The team will chat in links for the public notice and the link to the Contexture website. Moving on, let's talk about the Community Cares platform. Community Cares, powered by Unite Us, is a comprehensive statewide referral system focused on addressing social determinants of health. In partnership with Access, Contexture is collaborating with Solari Crisis and Human Services and 211 Arizona to implement Community Cares, specifically targeting the needs related to social determinants of health in Arizona. This system connects healthcare providers with community-based organizations, streamlining the referral process and facilitating easier access to essential services. Additionally, it provides timely notifications when social services have been successfully delivered. It is important to note that Community Cares operates as an independent platform, complete with its own portal that requires a login for submitting referrals and completing screenings. Eligible hospitals and providers can receive a DAP increase upon achieving milestones related to utilization of the platform. This table displays the program eligibility by provider type for CYE 2026. Just a few things to call out. The Crisis Bed Registry is only available to existing crisis providers who signed a Crisis Bed Registry SOW by 12/31 of 2022. Home and community-based services providers are eligible for different programs depending on their provider type. Specialty providers working only in the fields of obstetrics and gynecology, pediatrics, cardiology, or nephrology are eligible for HIE. Only these 4 specialty providers are eligible for DAP and CYE 2026. Family medicine providers and additional specialties are no longer eligible for DAP. This table displays the program increases by provider type for CYE 2026. Now I'll pass you to Kyle to talk about DAP CYE 2026 program requirements.
Thanks, Cassie, and hi, everyone. I'll be reviewing the HIE DAP program, starting with milestones and eligibility for data centers in the upcoming DAP CYE 2026. This slide outlines the key milestones and eligibility criteria for HIE data centers, which are categorized into 2 cohorts. Cohort 1, established HIE participants, and Cohort 2, participants that are new to the HIE. Eligible provider types for the HIE program include critical access hospitals, Indian Health Service facilities, skilled nursing facilities, behavioral health outpatient clinics, and integrated clinics. For established HIE participants, milestones are as follows. Milestone 1, sign a new HIE participation agreement and DAP statement of work by April 1st, 2025. Milestone 2, launch an integration project, establish a VPN connection to one platform, and send test data by March 1st, 2025. I do want to note that many established participants already have this integration project in flight and have sent test data to one platform. Milestone 3, actively utilize at least one current HIE service such as the HIE portal, ADT alerts, clinical notifications, or an interface that delivers patient data into your facility's EHR by May 30th, 2025. Milestone 4, electronically submit production data to one platform by September 30th, 2025. For providers new to the HIE, milestones are as follows. Milestone 1, sign the HIE participation agreement and DAP statement of work by April 1st, 2025. Milestone 2, actively access our new one platform HIE portal by March 1st, 2026. Milestone 3, submit external reference lab form by March 1st, 2026. Milestone 4, launch an integration project, establish a VPN connection to one platform, and send test data by March 1st, 2026. And finally, milestone 5, electronically submit production data to one platform by August 1st, 2026. These milestones ensure that participating providers utilize HIE services and integrate effectively with one platform, enhancing data sharing and interoperability. Now I'll be reviewing the HIE Data Quality Program eligibility criteria and milestones. This program is only available to data centers in Cohort 1 or established HIE participants. Eligible provider types include hospitals, other hospitals, skilled nursing facilities, behavioral health outpatient clinics, and integrated clinics. Milestones for the Data Quality Program are as follows. Milestone 1, sign a new HIE participation agreement and DAP statement of work by April 1st, 2025. Milestone 2, electronically submit production data to one platform by September 30th, 2025. Milestone 3, using January 2026 data, participants must complete an initial data quality profile assessment on 5 data quality measures by March 1st, 2026. These measures include data source and site information, patient demographics, race, ethnicity, and language. Milestone 4, participants must implement a quality improvement plan to enhance the quality of data elements by 3% collectively, unless the results already meet or exceed 90% for each measure. The quality improvement plan must be implemented by April 1st, 2026. Milestone 5, based on July 2026 data, participants must complete the final data quality profile demonstrating at least 3% collective improvement by September 1st, 2026. These milestones ensure improved data quality, ultimately enhancing patient care and system-wide efficiency. Now I'll be reviewing the HIE program for non-data centers. Eligible provider types include individual OBGYN, pediatric, cardiology, and nephrology providers, as well as home and community-based services provider types 23 and 49. Participants are again categorized into 2 cohorts. Cohort 1, established HIE participants, and Cohort 2, participants that are new to the HIE. For established HIE participants, milestones are as follows. Milestone 1, sign the HIE participation agreement and DAP statement of work by April 1st, 2025. Milestone 2, actively access at least one current HIE service by May 30th, 2025. Again, this can include accessing the HIE portal or engaging with other previously mentioned HIE services. For providers who are new to the HIE, milestones are as follows. Milestone 1, sign the HIE participation agreement and DAP statement of work by April 1st, 2025. Milestone 2, actively access the one platform HIE portal by March 1st, 2026. These milestones ensure that both new and established non-data centers regularly utilize HIE services, promoting broader patient data access and enhancing patient care coordination across healthcare systems. With that, I'll pass it back over to Cassie to review the SDOH DAP program.
Thank you, Kyle. I'll be reviewing the SDOH program milestones and eligibility for CYE 2026. Eligible providers are again categorized into 2 cohorts. Cohort 1, established SDOH DAP participants, and Cohort 2, participants that are new to SDOH DAP. Eligible provider types include hospitals, critical access hospitals, other hospitals, Indian Health Services facilities, behavioral health outpatient clinics, integrated clinics, behavioral health provider types A3, A4, A5, and A6, and home and community-based services provider types 23, 39, 40, 46, 95, and F1. For established SDOH DAP participants, or Cohort 1, Milestones are as follows. Milestone 1, sign the DAP Statement of Work and complete the Community Cares Access Agreement by April 1st, 2025. Milestone 2, attend the SDOH webinar or engage in a post-live touch base with your SDOH advisor to discuss training, workflows, and screening tool implementation by September 30th, 2025. Milestone 3, utilize the Community Cares platform to facilitate a combination of 15 screenings resolved off-platform or in-network referrals per month between October 1st, 2025 and September 30th, 2026. Milestone 4, throughout DAP CYE 2026, participants will receive quarterly worksheets and may meet with an SDOH advisor to review progress. If utilization goals are not being met, participants are required to implement an improvement plan. All goals must be achieved by August 15th of 2026. For providers new to SDOH DAP or Cohort 2, milestones are as follows. Milestone 1, sign the DAP Statement of Work and complete the Community Cares Access Agreement by April 1st, 2025. Milestone 2, complete the Community Cares onboarding process by January 1st, 2026, and begin utilizing the platform for screenings, referrals, and off-platform case tracking. Milestone 3, upon go live, the goal is to achieve a combination of 10 screenings resolved off-platform or in-network referrals per month. Milestone 4, after go live, participants will receive quarterly worksheets and may meet with an SDOH advisor to review progress. If utilization goals are not being met, participants are required to implement an improvement plan. Goals must be achieved by August 15th, 2026. These milestones ensure that participating providers actively engage with the SDOH closed-loop referral system, facilitating better coordination of social services for patients in need. With that, I will pass it over to Natasha to discuss the Crisis Bed Registry program.
Thanks, Cassie. Crisis Bed Registry is a state-implemented system designed to provide real-time information on the availability of crisis stabilization beds and related services. This tool enables healthcare providers, emergency departments, and crisis response teams to quickly identify and access open crisis beds, facilitating timely care for individuals experiencing mental health crises. The provider eligible for the Crisis Bed Registry are B5, B6, B7, 71s, behavioral health outpatient clinics, and integrated clinics. As it has been mentioned before, this is only available to existing crisis providers who sign a Crisis Bed Registry SAL by 12/31/2022. Milestone 1 is to complete the participation agreement, Crisis Bed Registry Statement of Work, and DAP Statement of Work by April 1st. Milestone 2, between April 1st and September 30th, continue sending stabilization data via HL7. Downtime must be resolved in a timely manner. Milestone 3, attest that all info to CBR dashboard is correct. Provider needs to update HIE if any changes are made by September 30th. Please review the CYE 2026 preliminary public notice posted January 30th, 2025 for further guidance, and reach out to your quality improvement advisor for questions. Thanks.
Now, Cassie will cover how to fill out the participant list.
Thank you, Israel. I am going to walk you through completing your DAP CYE 2026 participant list as an established provider in the DAP program. You will receive a partially completed participant list from your QI advisor via email. Just a quick note, when receiving the document, you may have to enable editing in order to complete this form. If this button does not pop up, try downloading it as an Excel file. We are unable to accept the file back as a PDF. The participant list will include all facilities or providers we have currently participating in DAP CYE 2025 who are also eligible for DAP CYE 2026. Please verify all of the information listed, ensuring that all IDs, naming conventions, and addresses are correct. If anything has changed, please note that in your email response or even as a comment in the appropriate cell. Comments can be added by right-clicking on the cell. If removing a participant completely, please delete them from the list. You can add any additional facilities or providers if needed, taking into consideration that any pending access IDs must be active by April 1st, 2025 in order to participate. If adding a new facility or provider, please indicate in column P that they are a new DAP CYE 2026 participant. DAP participation is based on the facilities and providers listed on this participant list at the time of submission. You cannot add additional facilities or providers throughout the year. Please note that the provider description and provider type columns both have a drop-down button indicating eligible options. The specialty column is only to be filled out if you are a provider working in one of these 4 specialties. Additionally, provider name is only necessary for behavioral health providers and specialty providers. All highlighted sections of the participant list must be completed by your organization. Please include the participant's legal name as listed on your W-9 tax forms. The authorized SOW or statement of work signer's name and email address are necessary to ensure that they are up to date and accurate, as they are responsible for signing all DAP contracts. The DAP contact should be someone who is regularly available for communication with their QI advisor. They are responsible for keeping the organization engaged and should be knowledgeable of the program. Please list more than one contact if needed. You will indicate your current electronic health record system here. If you do not have an EHR, please note that. If you are planning to switch EHRs, please indicate that as well. Next, you will indicate which programs your organization would like to participate in for DAP CYE 2026 using the drop-down button in each column. For more information on which programs each provider type is eligible for, you can click the Instructions tab here. Here you'll find written instructions for completing this form, as well as this table, which shows the programs that each provider type is eligible for. It is important to note that the Arizona Healthcare Directives, or AZHDR, is no longer a DAP program for CYE 2026. For more information about each program, feel free to click on the Programs Overview tab. For more detailed information, including milestone requirements for each program, please see the Access Preliminary Public Notice. Once completed, please return the participant list as an Excel file to your QI advisor. We will confirm completion, accuracy, and receipt of the document before sending it to your engagements manager, who will send out your DAP CYE 2026 SOW. If your organization has multiple tax IDs, an SOW will be sent for each one. If you have any questions while completing your participant list, please contact your QI advisor. Thank you.
Now, let's take a moment to explain the statement of work or SAL process. The first and second steps are for you all to complete your participant list and return it to dap@contexture.org no later than February 21st, which is next week. Once your participant list is received, the QI advisors will review the completeness and accuracy of this. Once it's approved, we will add the form as an exhibit to your statement of work, which will be sent to the authorized signer in your organization for execution via DocuSign. The authorized signer then will review, sign, and submit the SAL no later than April 1st. Please note that this is the first milestone for the Contexture programs, and after this date, we will not be able to receive SALs for the CYE 2026. Next, Larissa will cover the roles and responsibility for both parties, Contexture and participants.
Let's take a moment and review the roles and responsibilities of both Contexture and the participants. Milestones vary based on your provider type and are progressive over time. For each HIE milestone referenced in the DAP CYE 2026 preliminary public notice, these slides provide a description of the respective roles and responsibilities for both Contexture and the Access participating provider. It is important to review the milestones that apply to your organization and the respective roles and responsibilities to determine what steps and activities must be completed to achieve the DAP milestones. When it comes to the scope of work, Contexture's responsibility is to provide the participant list to the participants. Review and attach this participant list as an exhibit to the statement of work. Send this statement of work to the authorized representative at your facility. The participant's responsibility is to contact Contexture as soon as possible, and then complete and return the provider list by February 21st, 2025. The authorized representative at your facility must execute the statement of work via DocuSign no later than April 1st, 2025. For submitting ADTs electronically, Contexture's role is to provide participants with detailed technical specifications, listing the types of data required for submission within each category noted. Assign resources and complete all agreed upon timelines and activities to ensure that participant meets their DAP deadline. The participant's role, along with any vendor partners, is to complete activities related to the interface development and ADT data submission. It is important for the participant to stay engaged and meet all mutually agreed upon deadlines and requirements in order to meet all DAP deadlines. Contexture's role with data quality is to utilize the data sets sent in by the participant to create the initial data quality profile. Share this profile with the participant and discuss any gaps in data segments such that the participant can work internally to close those identified gaps. The participant's role is to collaborate with Contexture on any required activities in order for us to complete the initial data quality profile for the participant. Once the data quality profile is received, the participant will collaboratively review the gaps identified with Contexture and develop a work plan to address these gaps. I will now pass it back to Israel.
Lastly, we want to ensure that you will have the contact information accessible. Please reach out to your QI advisor for any questions regarding DAP. If you don't know who your QI advisor is, please email dap@contexture.org. If you are not an HIE participant yet, please contact us at getconnected@contexture.org. To learn more, please visit our website at contexture.org/DAP. Now, it's time to move to the questions and answer section.
All right. Thank you, everybody, for your attention to the presentation. So we want to purposely cover the content of this quickly just to make sure that we have enough time to go over your questions. So I know that my team has been answering some of the questions in the chat, but this is your time right now to come off mute and feel free to verbalize your question. And with that, I'll pass it to the team just to make sure if there are some questions that need to be answered right now.
Yeah. Hi, everyone. My name's Cassie. I'm going to pass it to Kyle really quick. We're going to cover, I think most of the questions got answered in the chat, but there's one that Kyle's going to go over really fast. Kyle, if you want to do that, and then we'll go through the hands that are up.
Sure, thanks, Cassie. We do have a question in the chat. Can you explain what the One platform is and if that is different from the Unitas platform? One platform is the name of our new HIE platform. We're switching to a new technology vendor. That is slated to go live in Q4 of this year. That is completely separate from the Unitas platform, which is a separate platform that is used for facilitating social needs referrals and screenings as well. I also saw another question in the chat that was in reference to individual providers. If you do have individual providers that are eligible for any of these programs, you can list them on your participant list. I would like to note that if the providers, if you bill at the facility level, only the facility will receive the DAP incentive. So if you list the providers and you don't bill at that provider level, you won't receive the incentive per provider. So just keep that in mind when you're listing individual providers on the participant list.
Hey, Kyle, there is a follow-up question regarding the One Platform and KPI Ninja. Oh, and it looks like Megan responded saying the same. One Platform is the move to KPI Ninja.
Thanks, Kelly. Megan, do you have anything else to add for that one?
Nothing else to add from me. Thank you, Kyle.
Thanks, Megan.
I think just to add to that, One Platform, KPI Ninja, HCI, I think you kind of will hear all of those terms. They're all the same thing. Okay, so Deborah, I think you were first. If you want to come off mute, you are welcome to share your question.
Yes, can you hear me?
Yes, ma'am.
Okay, first of all, I've been trying to participate in the chat, but it doesn't allow me to type anything. Do you know what, I mean, I have it clicked on chat and I've tried and it just doesn't, no chat. It doesn't allow me to do it.
I don't know. But
Okay.
I'm sorry.
You aren't the only one.
Okay, I've emailed, requested the forms 3 or 4 times so far in the last week, and I've never received them.
I'm just gonna look in our email real fast. Deborah, do you mind letting me know what your facility name is?
Accent on Family Care Services, and the emails from.
Go ahead.
The emails from Debbie Lee at accentsonfamily.com. I've received back just the general information, but never the forms that you went over just now. I never received anything that I could fill out.
Yeah, Deborah, we might be having some email issues then. I sent those to you earlier this week. I will take that offline with you so we can get you those forms. I'm sorry about that. I think we might be having some email issues.
Yeah, I did get your email and I did get some attachments with them, but none of the forms that I requested.
Okay, so that form I sent you, the participant list, that will start the process. So we need that first, and then we will process that so you can receive the necessary agreements such as the DAP SAO and the Community Cares Access Agreement. So that is the first step to complete that participant list spreadsheet that I sent you.
I didn't see a spreadsheet on there.
Okay, I will send that to you again then. I'm sorry about that. I think we are maybe having some email issues with you. And if you don't get it today, we'll work with you. Maybe I'll give you a call and we can work through that.
Okay, thank you.
And just for anyone else on the call, Deborah's referring to, she probably sent an email that said something like, we get a lot of these from new participants that said something like, can I receive the DAP SAO and a Community Cares Agreement in order to join 2026? And so, yes, like Kyle said, we will first send you back a participant list. We have to receive that back in order for our contracts team to make sure you're properly contracted, and then we'll send out those SAOs for you guys, just if that's another question. And then it looks like, yep, Dot, you're good to go.
Okay, so I'm unclear as a new provider. I'm unclear as to what the deadlines are. It looks like we've got to return a participant list by February 21st, which is next week. Is that correct?
Yes, ma'am.
Okay, so I don't recall ever having received that. Do I have to develop it, or where does that come from?
Are you you're a new participant or an established participant?
So well, we're an established company, but new with Contexture.
Okay, so you're going to go ahead and email DAP@contexture.org, and just let us know that you would like to participate in DAP CYE 2026. We will go ahead and send that participant list out to you, and then we'll just, once you get it back, our contracts team, we send that over to them. They'll make sure that you're properly contracted with Contexture, and then once we have all of that stuff good to go, they'll send out those SOWs or community cares agreements or whatever you're participating in.
But the deadline is the 21st, which is next week. Is that what I'm also hearing you say?
It is the 21st. It is the 21st. If you need a little extra time, go ahead and let us know that. And we're happy to work with you. But that's just so that we can get everything together, especially with new participants. So we get all of that together, because the milestone of 4/1 for that DAP SOW is a hard deadline. And so we have to make sure we have everything ready so that we can get that SOW signed back from you by 4/1.
Yeah. Okay.
So I wanted to mention that when you get that email from us, you'll get a tutorial video on how to fill that out based on being a new participant. So after you watch that video, if you still have any questions, just reach out to us.
Okay. And who's the QI? How do I find out who my QI person is?
Yeah, so once you email us that participant list back, it'll just get dispersed to one of us, and we'll let you know who that is when we'll send you like a confirmation email letting you know that we got that participant list and that you are on your way.
Got it. Okay. Thank you.
Of course. Craig, you're up.
Hey, how you doing? I've been trying to just ask questions and not get in the way. I have one kind of overall question, and you were expecting it, I know. This is Craig Sanderson from Common Spirit Health. Some of you might know me as Dignity Health. A couple of times you made reference to O2 providers no longer being eligible, and then on slide 17 there's a reference to O2 providers being eligible. Could you help clarify what that means? Because it's a big change.
Yes. Israel, I don't know if you can share what slide 17 is. Maybe it's the DQI one. So Craig, I think we had emailed, I'm going to try to do this without knowing. This is 17. So hospitals or O2 providers are no longer eligible for HIE DAP. However, there is the HIE data quality DAP, which hospitals are eligible for this year.
What's the difference? I'm sorry, I heard HIE twice and I get confused easily.
No worries. So HIE is participating in the HIE program. I know we have had a lot of conversations about this, Craig, like the portal access and all of that. The data quality is what we're working on with your pre-analysis and sending those specific data quality measures. And we'll go back to, I think it was 2023 when we had those data quality indicators. And so several times throughout the year, I think we'll go through and Kyle can maybe speak better to this. I wasn't here for this, but we will go back to those data quality indicators to see how your facilities are performing. Kyle, feel free to jump in.
Yeah, so Craig, we'll be evaluating data quality profiles again, like in years prior. So we'll be evaluating 5 measures, which are data source, demographic information, race, ethnicity, and language. So essentially, we'll be taking messages sent to the new platform and evaluating those for either completeness or correct values, and then running a data quality profile. And part of that program is if any of those measures are below the 90% quality threshold, we'll be working on an improvement plan with you to improve those measures by a collective 3% on the final data quality profile, or 90%, whichever is greater. If we reach 90%, great. That's good.
We fixed that 4 years ago. That's not a concern. It was more the reference to the O2 providers. I guess what you're saying is at a facility level, we're still eligible, but not at the individual level unless they're in that specialty group.
Correct.
For providers, yes.
Thank you.
I think Tara,
did you have anything
next.
else, Craig? I'm sorry.
I have one other more generic question. I'm okay if you can't tackle it on this one. For the DAP program, this has been active in Arizona for about 6 years. Do you know if there's any move to maybe do something DAP like in Colorado for the future?
Megan just answered this in the chat while you were talking, but she said DAP's not in Colorado, but they do have other programs like the alternative payment model and the hospital transformation program that are both designed by Medicaid.
At some point, I'd love information on that. No, there's no deadline or rush for it, but thank you.
Sure. I can see if I think maybe Sandy could get you that information, but I'll chat with Sandy or Megan and see who can get you that.
All right, thank you. No other questions, and I hope your video goes viral.
I hope so too, Craig. Thank you. Tara, it looks like you're next.
Yeah, hi, I'm Tara. I'm with Center for Health and Recovery in Phoenix. I guess I really just want to make sure I understand correctly that because we're already an existing participant, we're part of cohort 1, but it is possible that if we've developed a new program that we are part of cohort 2 as well, because the new program, right?
Yeah, Tara, I think I've been in communication with you, right? So I think you have a new facility, if I remember correctly. So yeah, in your case, your case is slightly different because you are established participant in DAP. So for your A3, if I remember correctly, you have a behavioral health provider already there. And now you're adding, I believe, a 77. So the 77 will be considered a cohort 2.
Right.
So they will follow that. So that's why you see here the asterisk in here, because HA data quality is only eligible for cohort 1 participants, established participants in DAP. So in your case, will be like kind of like a hybrid. So some will be for cohort 2 and cohort 1. Yeah.
Okay, I just wanted to make sure I understood correctly that I was having to follow 2 different sets of directions for the 2 different programs.
Yeah, no, and definitely we can set a time, you and I, if you want, just to go over your specific questions, and I just want to make sure that you are clear with all this.
Perfect. Thank you so much.
Yeah. I think Ashur is next.
Yes.
Thank you. Did you say Azure? I'm sorry.
Yes.
I did.
Okay, thank you. Okay, so if I'm completing the DAP for 2026 participating list, it's safe to assume that we've never been registered, because I only ask because our hospital has brought this up many times in the past and it never got off the ground. So I just wanted to establish we're not an established
Can you tell us your facility name and we can just double check?
Yes, Phoenix Medical Behavioral Hospital. And my participating list that I got, it was pre-filled out, and they do have us as a provider type 71, and I did want to just be sure that is correct.
Let me just check something really fast.
And we can also check offline just to make sure, because if you receive that preloaded participant list, that means that 71 was already established in that.
Okay.
But we can chat on offline if you want, just to make sure that we're sending you correctly the participant list.
Okay, and then looking on the provider table, it does show that we are eligible for either the HIE data quality and the social determinants. However, kind of listening into your slides, I'm not sure we actually do qualify for the data quality just because we're new at this point in the game. So would we only be technically signing up for the social determinant?
Yeah, I think if you want to send all of those questions in an email to your QI advisor, they can kind of look a little more into it. And we can see if you're currently a data sender and you would qualify for that data quality, or what exactly is going on with that. And then they can kind of talk you through SDOH too. And we're happy to jump on a call if it's easier to talk through it than it is to email through it.
Okay, perfect. And I think the question, I think the last one I have was, I've seen you guys mentioning about providers, and we don't employ providers, but I don't know if that matters. But then also, since we don't do the provider billing, from a facility standpoint, then we're just putting ourselves on there and not having to worry about listing out providers.
Exactly.
Perfect. Thank you.
Yeah, of course. Veronica, you can go.
Hey, thank you very much. Veronica O'Hara, DMG CRS. I had a couple of questions. Israel could probably answer me the best. We are in cohort number 1, I believe. And then also, what do I have to do to be a participant provider for CYE 2026? What's the deliverables for that?
So I send you the participant list already preloaded.
Perfect.
So just review it, make sure that looks okay. You need to add, remove, feel free to do so. Send it back
Okay.
to us. I'll review it, make sure that it looks good. After
Okay.
that, we'll send it to the engagement team, contract team, and they'll send you their the SAL via DocuSign just to execute. But yeah, if you don't see that, let me know. I can resend your participant list, but you should have received it at the beginning of February, I
Yeah,
believe.
I did, Israel. I did. Thank you. And I just reviewed
Okay.
it again that I do have it. Israel, what is the percentage on these 3 categories or 4 categories?
Let's see here. So here, this slide shows the percentages for each category.
Okay, give me a second.
And
Will this slide
you'll
come
get,
out to us?
sorry?
Will this presentation be emailed to us?
Yes. So, well, I don't know. We can definitely email it to you, but it will be available in our website, so we can post that slide deck and also the video recording right now of this presentation. So it's going to be posted in our website. So we have already put it in the chat multiple times right now. So you just make sure that you bookmark that website so you get access to all these resources.
Okay. Thank you. Great presentation.
Rhonda, it looks like you're next.
Hi there, I'm Rhonda Murray from Unite Cerebral Palsy, and just a quick question on the participant list. In the last column, new DAP CYE 2026 participant, we did receive DAP through access for EVV. So would I answer yes? Or not sure how to answer that.
Yep,
Has not participated.
Yeah, so since you're new to the Contexture programs, go ahead and answer yes to that question, and that way we can make sure you're properly contracted with Contexture as well.
Okay, so we have been on board this year with Contexture. Would we still be considered?
Not with any of these Contexture DAP programs?
This is our first year we started participating the end of last year.
In only the EVV one?
We got signed up for Contexture as well.
But not like an HIE DAP or an SCOH. Why don't you put yes, and then we'll just verify it.
Okay, all right, fantastic. Thank you.
Of course. Okay, does anyone else want to raise their hand for a question? It looks like we got some more questions in the chat that I think are being answered. But anything else? Peggy, go ahead.
Yes, Peggy Ortega, Soaring Eagles Home Healthcare. We have been a participant at we have 3 branches for Soaring Eagles, and we discovered that only one of the branches was registered, and that is our Phoenix location. We wanted to add the other 2 locations. They all have the same access ID and the same TIN number. So is the deadline to add or register the other 2 branches February 21st as well?
Yep, so go ahead and just add all of them to that participant list, and I think I sent it out to you. You should have 2, because we have Circle of Life and Soaring Eagles, I think.
Correct.
Yes, so I should have sent you both of those.
You did, so I did put all 3. I just wanted to make sure I was doing that correctly.
Perfect. And if they have, I think they're contracted, they have the same TIN.
Well, Soaring Eagles does have the same TIN and the same access ID. Circle of Life has a separate access ID and TIN.
Okay, so each facility with a different TIN number is going to need a separate participant list.
Correct.
Because we
I did get
those. perfect, because we contract those separately. If you have additional facilities, I'm happy to send you a blank participant list, or you can just make copies of those and add your other facilities, or if they have the same TINs as those facilities already participating, go ahead and add them on the appropriate participant list and send those back. We do need them back by the 21st, just so we can make sure we get everything else contracted to get those SOWs out and get them back by 4/1. 4/1 is the first, or April 1st is the first milestone date when those are due.
Okay, February 21st. And okay, perfect. Thank you so much.
Of course. Catherine, do you have a question?
Yes, kind of similar. So we have already been participating. We have our participant list to submit for 2026, but a little different. So on our participation list already, we have technically 3 locations, all have the same tax ID, all have the same access provider number, and all of our locations are already listed on one line on the participation list. Do they need to be separated out, or do I leave them as we received them?
Yeah, so access payments are based on access ID. And so if they all have the same access ID, but just different locations, like if everything's the same access ID, provider type, all of that, but they just have different locations, that's just how we put them in our tracker this last year. So you can leave it as is.
Okay, perfect. That's just all I needed. Thank you.
Yep, absolutely. There is a question in the chat that I might need Megan's help with. Kyle, I don't know if you have this one in I don't have your thing up, but it says, it's from Darlene. It says, we're new to DAP. We're currently on NextGen. My understanding is that NextGen will be a participating vendor. Do you know when NextGen will be live? Megan, if you can take that, and then I'm going to take the second question. Since family medicine is not eligible to participate, is there another program that is eligible for family medicine? The answer to that question is no, there's not this year.
Cassie, I'm going to jump in and answer the next gen question. So for any net new participants to Contexture as an HIE, we will need participant agreements in place with a statement of works, and then your practice will be put into a queue in order to go live and send data to the HIE and access the portal. So it depends on in the queue for that project. So we'll take next gen participants live as those projects are rolled out.
She says, thank you. Okay. Kyle, do you have more questions in your QA?
Yeah, I see a couple here. One from Paula. Hi, Paula. The question is, if we're integrated with PCC, does Contexture automatically receive the HIE data quality measures as provided through PCC data? And the answer is yes, Paula. We'll be receiving data from your facilities, and we'll be running data quality profiles based on the data we're receiving. And then a question from Charles Hirsch. One issue we ran into was related to the fact that our data is Part 2. And as a result, we had trouble getting a review of our data. What options do we have for that in data quality review? Charles, as part of the DAP program, the HIE program, it does require both Part 2 and non-Part 2 data be sent. So maybe you can come off mute and elaborate on your question a little bit there, if you don't mind.
We kind of default to all of our clients being considered Part 2 because it's highly likely that they will have substance abuse related information because we're dealing with clients that are in the justice system.
So we are receiving.
So we don't. Yeah.
So we are receiving all data. We're just classifying it as Part 2.
Correct. And and the reason is because I can't reliably say whether or not they are Part 2 or not.
Sure. And yeah, and that is completely acceptable for DAP. So no issues with classifying all the data as Part 2 for the program.
But we'd asked a question at one point along the way, if we were doing things correctly in terms of the codes and stuff we were sending over, and didn't hear back because the data was Part 2 and the person reviewing it couldn't see it.
That was on our, yeah, that's a good question. That was on our old platform. Let me take that back to our integration team and I'll get an answer for you on that if that's an issue, if that will be an issue on our new platform going forward.
Okay, thank you.
Yep, no problem.
Do you have any more questions in the Q&A?
Let me see. I'm just checking.
I have a brief
here.
one. I just want
Go
to
ahead.
clarify. I think that's been clarified before. I just want to check. If we have interfaces directly in and out of your new platform, does that mean we are meeting the need to access your portal? Because our providers will never log in directly.
You're on mute,
You're on mute,
Cassie.
Cassie. You're still on mute, Cassie.
Man, I had such a good comeback too. Because you're not eligible for HIE this year, it does resolve your portal situation. You no longer have to log into the portal.
That was an interesting response. Thank you.
Does that answer your question?
Well, we encourage you to use the portal, but it's not part of that.
We do, but I know your stance on it, Craig, and so that's why I gave you that response.
Well, I've used your portal and I like our community view better. But anyway, thank you.
Yes, you're welcome.
All right, so looking at time, so we only have 2 minutes. I want to be very cautious about time. Feel free to reach out to us if you have any questions. So we are going to be sending again it will be posted, the slide deck, the recording of this. If you don't know who your QI advisor is, please reach out to us at dap@contexture.org. We are going to be happy to reply to your email and let you know who your advisor is. And if you had more questions, feel free to schedule a meeting with your QA advisor. Again, email us and we'll cover those in there. So we want to thank everybody and just want to check really quick if we cover everything with the team. Is there anything else that we missed that hasn't been covered yet?
There's one question in here that says, will one platform have the capability of sending CCDAs from the HIE to our EMR with the direct message address that we have with our vendor? I don't know, Israel or Kyle, if you want to take that.
Maybe we can, because that's probably going to take longer than 1 minute. But maybe we can capture that question and make sure that we follow up offline after this. Does that work? I don't see the question, but we want to make sure that we capture that. And okay.
Yeah, I'm okay with that, Israel. We can follow up with that. Yeah.
Perfect. Thank you. I appreciate that.
And then John, do you have a last question?
Yeah, I was just curious. It doesn't seem like BHRFs have ever been part of this. Residential facilities, type B8s. Is there a reason for that?
Is Margaret still on the call? I don't know if Margaret wants to answer that.
Can you hear me?
Yes.
Yes, we can.
Hi, John. So when we evaluate the DAPs and what provider types are eligible, we use our agency's subject matter experts and external stakeholders, and we kind of decide where we want to incentivize behavior change, but we're also limited to the available DAP funding. So we kind of look at what provider types we can do each year. So unfortunately this year it wasn't a need. But it's something I would recommend putting in our public comment. So we have public comment period until March 1st. I would put that in writing and send it to Access.
All right, thank you.
You're welcome.
Thank you, Margaret. And I want to thank everybody. So we are past our time now. So we're going to conclude our webinar for CYE 2026. I appreciate your time and we'll talk to you soon.